Denial codes in behavioral health billing are blocking up to 40% of claims on first submission, and most are preventable. Every claim adjustment reason code is a direct message from the payer about what went wrong. Decode it, fix it, collect the revenue. This guide covers the CARC system, the codes that hit addiction and mental health programs hardest, and 7 prevention strategies with the biggest impact on your revenue cycle. We will cover the top denial families for behavioral health and how to stop them before they reach your remittance. Medical billing denials cost U.S. healthcare providers $262 billion annually. Up to 40% of claims are initially denied due to coding, eligibility, or documentation errors. Each one takes 14 to 21 days to resolve. Staff hours and delayed cash flow that compound every billing cycle. Denial codes, officially Claim Adjustment Reason Codes, CARC, identify why a claim was rejected or adjusted on your remittance advice. RARC codes add explanatory detail on top, the footnote behind the main denial reason. Every code falls into one of 5 families: eligibility, coding errors, authorization and medical necessity, duplicate billing, or contractual obligations. Behavioral health programs see the same denial patterns repeatedly. 7 families account for most revenue leakage, root cause and fix for each. Let us walk through all 7. CO-197, service provided without the payer's pre-certification on file. Common for inpatient rehab, residential SUD, or level of care transitions where staff missed the payer's auth requirement. Submit retroactive authorization with clinical notes. Use peer-to-peer review for expedited approvals. Automated tracking tools and calendar alerts stop authorization expirations before they become denials. CO-50, payer disputes clinical justification. No DSM-5 link, no ASAM criteria in the notes. Common for MAT, prolonged therapy, or extended residential stays where progress notes are incomplete. Appeal with ASAM criteria and session notes showing measurable clinical progress. Embed ASAM dimensions in note templates so every session auto-generates payer-ready documentation. CO-16, incomplete claim data, invalid NPI, missing modifier, bad demographics. For CCBHC programs, add national outcome measures data and resubmit. For other claims, correct the flagged field. Real-time eligibility checks and EHR edit rules catch incomplete claims before submission. CO-59 and CO-97, the bundling denials in behavioral health group therapy billing. CO-59 fires without modifier 59 to flag them as distinct same-day services. CO-97 fires when 90853 is billed alongside an IOP per diem rate. Use revenue code 0916 for the IOP. Build EHR rules, flagging modifier 59, and map codes to OPPS billing guidelines. CO-27 and CO-31 spike after Medicaid redetermination, lapsed or unrecognized coverage. CO-31 fires when the payer cannot match the patient to an active enrollee after Medicaid IDs change. Run eligibility checks 48 hours out and assign case managers to track redetermination dates. CO-22 and CO-301 trip up dual eligible and carve-out billing. CO-22 fires when primary and secondary payers are misidentified for patients with Medicaid and commercial coverage. CO-301 fires when the medical plan redirects to a carve-out like Beacon Health Options that was never billed. Collect other health insurance forms at intake and map carve-outs during eligibility checks. CO-58 and CO-242, place of service and extended stay documentation denials. Rebill with POS 10 and modifier 95 for office-based telemedicine. Update EHR POS logic quarterly. Appeal with daily notes showing stabilization barriers. Standardize ASAM continuum documentation for every concurrent review. The biggest gains come from automating the steps staff do by hand, eligibility checks, and prior authorization. Real-time eligibility verification reduces eligibility denials by 62%, according to MGMA data cited in the guide. Automated prior authorization reduces manual follow-up by 80%, per KLAS research cited in the guide. BehaveHealth.com is designed to help your team automate eligibility checks and prior auth tracking inside the workflow. Prevention beats appeals. These are the 7 highest impact strategies for behavioral health programs. Flag inactive policies before admission, the highest leverage fix for avoidable denials. Embed SUD severity scales and ASAM dimensions, so required data is always in the note. Flag denial-prone claims before submission and prioritize pre-submission review. Catch ICD-10-CM errors and modifier mismatches before they compound. Submit with progress notes and ASAM assessments. Track success rates by denial code. BehaveHealth.com is designed to support denial prevention across your revenue cycle. Flags missing modifiers, like HA format, before any claim leaves your system. Calendar alerts and concurrent review reminders built into the workflow. Surface trends so your team targets the highest volume, most recoverable denials first. Track every denial and appeal, with immediate notification when an appeal succeeds. Most behavioral health denials are preventable with the right workflow. See how BehaveHealth.com is designed to help your team catch denial triggers before they become write-offs. Book a 20-minute demo at BehaveHealth.com and see denial management built directly into your revenue cycle.